The treatment approaches to depression are different from person to person. It will completely depend on what that person feels is the right thing for them. And I would say any treatment approach is always a collaboration between the person and the professional that they are speaking with. There are three main areas that I think about when we're thinking about treatment for depression: lifestyle, psychological support, and lastly, medication. Thinking then about medication, medication is often something that people will come to having tried some of the lifestyle things we've spoken about, or having had some psychological support already. Medication generally will be prescribed by a medical professional, a psychiatrist, a GP, and typically that will be an antidepressant. For most people, that will be taking one antidepressant, usually in the morning, though sometimes we might prescribe a medication that's taken in the evening, particularly if people are having difficulties with sleep. We might prescribe an antidepressant that also has benefits when it comes to sleep. For most people, the first antidepressant will be helpful enough that that works well and we don't need to change anything. However, if the first medication doesn't work in the way that we want it to, then there are alternatives that we can try. We might add in another medication to help enhance the effect of the antidepressant. And with medication, we only want to be prescribing things if we know it's being helpful and if it's not causing significant side effects for people. So medication always has to be a two-way conversation. So if people feel that the medication isn't giving them the benefit they want, that the side effects are too troublesome, or even if they've just changed their mind and they don't want to be on medication, that's okay. We can work out a different way of managing things. People typically will remain then on an antidepressant for somewhere in the region of 6 to 12 months. And medication doesn't have to be a lifelong thing for people. It should be reviewed usually after that 6 to 12 month period once people are feeling better. And the hope then would be that we could try a reduced dose or potentially look to stop the medication, not in a rushed way, but in a way that really suits that person, so that in the longer term, their life is functioning in a way that works well for them.